And rising overdoses. The Hampden DA, along with the Hampden County Sheriff, commending the Hampden County Addiction Task Force for all their efforts in cracking down on fatal overdoses and providing resources to those suffering from addiction.
Western Mass News reporter Reagan Locree joins us live in Springfield with more on the progress made so far. Reagan, what can you tell us?
Yeah, that's right, Amanda and Chris. The Hampden County Addiction Task Force, or HCAT, was developed about 10 years ago when the Hampden District Attorney, as well as the Sheriff's Office, realized that there was a huge problem with addiction in our area and it needed to be addressed. The Hampden County Addiction Task Force, also known as HCAT, is a multi-agency initiative led by the Hampden County Sheriff's Department as well as the Hampden District Attorney's Office. The rapid response team works side by side with law enforcement, healthcare providers, outreach workers, and treatment programs in order to provide resources after someone experiences a non-fatal overdose.
Incredible work that's being done with folks who experience a non-fatal overdose, and there is direct outreach to them and to their families within 24 hours after that incident, really reaching out at that vulnerable time to ensure that services are provided in a very non-threatening way to make sure that individual going through that experience has an opportunity towards recovery and doesn't return to substance use.
One tool HCAT also uses is called SIMS, which is a web-based tool created by Kelly Research Associates, as well as law enforcement to map and track overdoses across the state and beyond. This program helps HCAT collect data which shows them their progress in fighting addiction. Since the beginning of the program, HCAT has done over 2,200 total outreach attempts. Over 1,300 of those contacts have been successful, and 231 people have been assisted into treatment. And more recently, between June 2024 and June 2025, the team successfully assisted 147 individuals into treatment. And when comparing January through June of 2024 to the same time frame in 2025, the data shows that fatal overdoses have gone down 23% and non-fatal overdoses have gone down 16%, while at-risk referrals have gone up 50%. Hampden County Sheriff Nick Kochi tells us this data proves how successful HCAT has been in its fight against addiction.
We've hired great people, great staff that can get the work done.
The SIM software can also help provide resources to people who have overdosed, even if the overdose didn't happen in their hometown. For example, Pam Kelly of Kelly Research Associates told a story at Wednesday's meeting about how the software was able to connect someone who overdosed on vacation to resources when he got back home.
They utilized SIMS, that person overdosed, they were able to tell Danvers that, hey, one of your residents was just on vacation, overdosed. When they get home, you should reach out to that person. And so it was a strange but wonderful connection was able to be made. And that person was very grateful.
Now, Sheriff Kochi tells Western Mass News that this is not just a Springfield issue or a Holyoke issue or even a Chicopee issue. This is an issue that happens in every community across Western Mass and beyond. Now, if you or anyone you know is struggling with addiction, we do have resources on our website. Head to our website, westernmassnews.com, for a link. Reporting live in Springfield, Reagan Locree for Western Mass News.